Amblyopia is a very common eye problem that I see in my clinic. I see it every day. It affects up to 5% of all kids, so on average there will be at least one child in every classroom that has amblyopia. Amblyopia is poor visual development in childhood, and if it goes undetected and we don't treat it appropriately, then it becomes permanent. It happens, like I said, in up to 5% of all kids, and it has three main types. It can happen because an eye is misaligned, for example, an eye that turns in or drifts out. It can happen because the child has a need for glasses that we don't know about, we don't find out about, and we don't treat with glasses. Or it can happen if something's in the way of the vision, like a cataract or a droopy eyelid. And in each of those scenarios, what happens is the brain will pick a favorite eye. For example, the eye that's seeing straight, it'll devote all its resources to developing the vision with that eye so that the vision develops well in that eye at the expense of the other eye. So the eye that is often turning in or drifting out, the brain sort of figures, oh, I'm not getting anything useful from that eye, and it devotes all its resources to the other eye so that the vision doesn't develop normally in that eye. The first step in treating amblyopia is figuring out what the cause is. In the rare circumstances where amblyopia is due to something in the way of the vision, like a cataract or a droopy eyelid, the first step would be to correct that with surgery if needed. Far more commonly, however, the cause of amblyopia is due to strabismus, which is eye misalignment, or due to refractive error, which is a need for glasses. And in those situations, the first step is often glasses to see if that will help. And if that does, and the vision normalizes, the amblyopia is treated successfully, and there isn't any other treatment that's needed. However, in many situations, glasses alone are not sufficient, and other treatments are needed. The mainstay of treatment is patching. Patching is done over the better seeing eye, the preferred eye, so that the brain gets some alone time with the amblyopic or poor seeing eye. I always tell my parents and patients that it's sort of like if you had one strong arm and one weak arm. Patching is the equivalent of putting the strong arm in a sling for a few weeks and doing everything with your weaker arm so it gets all the exercise, it gets all the undivided attention from the brain, and it can help the vision to normalize. In some situations, patching isn't possible, and we know that, we understand that, and in those circumstances we will often turn to an eye drop that parents can put in their child's eyes once a day to blur the vision in the better eye so that the brain can pick up the signal from the poor seeing eye. There are also some exciting research opportunities that are going on right now, and we're part of those here at the Spokane Eye Clinic, using some video game technology and some specialized glasses that may show some promise for treating amblyopia. Amblyopia is important to identify and treat as early as possible because the sooner that it's identified and treatment is initiated, the better the prognosis. Younger children do better with treatment, and as they get older, the prognosis gradually worsens with time just because the brain's maximal visual development typically has taken place by the time the child turns 8 years old. And so if we can find these children early through the use of routine vision screenings in the medical home, for example, the pediatrician's office, or at school when the child is old enough to go to school, children that fail those vision screenings are referred into the pediatric ophthalmology clinics so that they can be treated appropriately. The younger they are, the better they do. When children are referred early on and treatment with patching is recommended, we follow them very closely and regularly because we know that they will improve quickly. Children that are referred to us with amblyopia with a new diagnosis at around age 8, we often attempt patching and glasses as treatment, but it's not always successful because by then maximal visual potential has often been attained. For adults that have amblyopia, we see those from time to time in our clinic. Unfortunately, the prognosis is not as good. The key period for people with amblyopia is between the ages of 0 and 8 years old. I'm Matt Weed, and I'm a pediatric ophthalmologist and adult strabismus specialist at the Spokane Eye Clinic. And I love seeing children and adults with strabismus and children with amblyopia and helping to figure out how we can give them a lifetime of straight eyes and good vision.